right, Mark, so how's the recovery process so far?
I'll let you know tomorrow. What's great about these kinds of things is that you're asleep through it and you don't remember anything. So it's kind of a miraculous type of approach. But I have a little bit of pain, but that's it.
So compared to other, have you had other surgeries before?
I had a surgery back in June, and it was in a, we live in La Quinta, the Palm Springs area, so to avoid driving back and forth, we stayed in a hotel for about 5 nights, I guess.
Oh, wow.
Yeah.
So that
Yeah.
first surgery in June was a 5-day recovery?
Well, they just kept me in the hospital rather than having me drive back and forth.
That's serious.
Because it's a 2 or 3 hour drive, you know, depending on traffic. So
how long is the recovery process for this surgery?
Well, they said originally 6 weeks or more for the other surgery. They're saying it could be similar, although I was back at work 2 weeks later.
Oh, wow.
So the robot delivers as promised, because it gets you on your feet a lot quicker, and you don't have giant incisions and scars and all the other stuff. So, yeah, it's been great. I'd recommend you do it, as a matter of fact. I'd recommend you do it, as a matter of fact.
Absolutely. So was it stressful at all before, or was there anything you're concerned about that after you feel better about?
Well, I haven't had a debriefing with the surgeon yet, but we were anticipating no challenges other than the surgery itself. And so we went through the different alternatives as far as treatment and medications and do nothing and radiation and all the other things. And with any of them, there's going to be trade-offs physically. So, you know, this seemed like a good trade-off, and I'll be walking out of here pretty soon.
Fantastic.
So, yeah.
So would you absolutely recommend this to anybody that wanted to go the robot route?
Well, I would, but I don't really know enough about it. In other words, it seems like a big factor is the patient's age, physical condition, the time, you know, all the other things. For me, it seemed like a very good fit, kind of a, you know, natural progression in the option chain. For you, or, you know, anybody else, there may be different options that they want to pursue. So,
for the most part, it was a good experience. I know you're still coming out of it, but
well, in the scheme of things, yeah, it could be a lot worse. It's not like the old days where they had to crack ribs and,
right,
you know, go inside and do it all over again and
yeah,
stitch it, and you know, because that's a long recovery. So,
absolutely.
yeah. Yeah.
So did you get a chance to look at the robot or
No.
anything?
In fact, the last thing I remember was sitting right here in this bed until you guys came in.
Well, I'm sorry I was in that.
No. It's good. It's good to see you guys. What they tell you with the anesthesiologist is that they basically include a mixture of solutions, and part of it is there's some element that helps retard memory. Right. So I literally thought I was going to be in a different bed, and I woke up in this one. Here I am. If there weren't a clock on the wall, I might think I didn't do it yet.
Unbelievable.
Yeah.
Wow.
So
far so good.
yeah.
Well, appreciate the time.
Glad to do it. I hope you never have to do it.